So good to have you with us, Richard. And it was really great to meet you at ICAM in Halifax last week. And I would like to welcome you to the AFMC board as our first ever Indigenous public board member. Please tell us a little bit about yourself.
Yeah, well, I'm a Labrador Inuk, beneficiary under the Labrador Inuit Land Claims Agreement, which was signed in 2005. I come from a professional background of largely working in the federal public service for more than 30 years, and for around half of that time, I worked in the health field. So I was one of the creators of an early childhood development program initiated by the then Population Health branch of Health Canada. The program was called Aboriginal Head Start in Urban and Northern Communities, so an early childhood development program managed by community organizations in Indigenous settings. So that program was launched in 1995. Um, and I worked in that program for about 9 years. I was the national manager, and in fact got a Queen Elizabeth II Golden Jubilee Medal for my role in that, in helping to set up that program. I worked in a range of things for the feds, including land claims and self-government negotiations. My last gig with the feds, which brought me to Montreal, where I now live, was as the regional executive director of the First Nations and Inuit Health Branch. That was when I joined part of Health Canada, but was later transferred to the newly established Department of Indigenous Services Canada. So I was there for 5 years, and then retired from my federal career and joined McGill University in the Department of Family Medicine as an assistant professor. So, not having been an academic before, I had really very little idea about what I would be doing, but um, found from the outset that there was very little um, teaching going on in relation to Inuit health. So I thought that that was a kind of logical place to start to do some work. So I developed a course in, what are we now, five, in 2022, called Inuit Health in the Canadian Context. It's an academic course, mainly targeting family medicine's MSc and doctoral students, and students from elsewhere at McGill also. Um, that course will be becoming, so that was it's a 1 credit course. That course will be becoming a 3 credit course next year. And we will be able to cover material that includes what's going on in Greenland and also in Alaska, because of course is becoming Inuit health in the circumpolar world. I teach modules to undergraduate and post-grad med students, residents, and I guess lecture in a bunch of other places at McGill. And I'm involved in a bit of my own research, a social historical research project on a hospital that was established in my mother's community in Labrador, Northwest River, in 1915, that was there until 1983. My research project is about the impact that this hospital had on the local community and the impact that the local community had on the operation of the hospital and the way the hospital ran and the way the hospital provided services and all that kind of stuff. It's kind of a bilateral cultural change thing that was going on there.
That's amazing and incredibly impressive. We are very lucky to have you with us on the board at AFMC. Um, Given your background and the many angles at which you've come to these topics, what sparked your interest in becoming a public board member with the AFMC's board of directors?
I am interested in national work of national significance. So I see AFMC as having the potential to influence what is going on in medical education and other things, but medical education, my kind of specific interest across Canada, and in facilitating sharing and working at offering the best kinds of medical education in relation to Indigenous knowledges across the country and influencing things like cultural safety in healthcare um, that I think needs to be acknowledged and supported and facilitated across Canada, even while we know that approaches can and should be locally and regionally specific. But to be able to work in concert with institutions across Canada, I think that's a huge advantage. And I don't think that there are a lot of organizations um, that are in that kind of position. So that was part of my attraction, and I'm interested in policy making on a national basis as well. And I think AFMC has the capacity to do and to influence what happens all across the country.
Amazing, thank you. So one last question for our audience to get to know you a little bit as we head into a new year here at AFMC. Can you tell us a bit about what you see as the biggest challenges for academic medicine in Canada?
Um, I think there is still a challenge in terms of the diversity of the student body. So we know, and I'm speaking specifically about numbers of Indigenous students in, I think all health professional streams. Indigenous people are still underrepresented in all of the medical professions compared to their proportion of the population in Canada. It is better than it was, but I think there is still room for improvement. I think we want to be able to target um, matching participation in the health professions to the proportion of Indigenous populations in Canada. I think that should be an explicit kind of goal for us all. I think accessibility is continues to be an issue. Accessibility into health professions. So, I think we have a role in continuing to work to improve that. Um, and I don't know. I guess I would say on the other side of challenges, my impression from having attended one meeting is that we have a very collegial, um, collaborative kind of group of people who all want to work together to make um, faculties of medicine the best that they can be and medical education the best that it can be across the country.
Well, I think you're bang on. I've been with the AFMC for just over a year now, and that has proven itself to be true. Look,
Mhm.
Richard, I want to welcome you to AFMC and the board
Thank
of
you.
directors, and
Mhm.
we are delighted to have you on board. And I have every confidence that you will help us tackle that very challenge of increasing diversity and the teaching of Indigenous health and ways of knowing, and embedding that into our curriculums across the country. So thank you
Mhm.
so much for your service.
You're very welcome. Thank you.